Every day, honestly, when I talk to engineers, I'm hearing new terms.
Mm.
There's always like something. And I just ask if I don't know what it means because guess what? They also don't know what some of the clinical terms mean. I've had to explain HIPAA, I've had to explain prior authorizations,
Yep.
but they've also had to explain to me what a JSON blob is. That's a real thing that I've heard.
Okay, listeners, welcome back to another episode of Corporate Espionage. Today, I am completely thrilled to welcome my friend and colleague, Lauren Curtis. She is a pharmacist who was told that she was wasting her degree when she left retail pharmacy for tech, but she did discover that her clinical background was actually her secret weapon. She jumped in with PillPack in the very early days and scaled their customer experience team from 5 to 50, then pivoted to product. Since then, she's been a product manager at companies like Amazon and Chewy. Along the way, she's also founded Hey Health Tech, a newsletter reaching over 6,000 healthcare professionals. Congratulations, by the way, who want to understand and be a part of building technology that is transforming our industry. So, welcome, Lauren. Thanks so much for being here.
Thanks for having me.
Yes. So let's jump right in. I really like to start with just giving you the floor and giving our listeners a little bit of insight into who you are, what you care about, and what you're doing.
Sure. Yeah. So my name is Lauren Curtis. I am a pharmacist by degree. I have been working in tech, as you mentioned, for about 10 years now, which is wild. It has flown by. I'm sure that many people will understand that working in startup life can feel like things are moving at the speed of light, but also like can feel like it's taking, you know, aging you at lightning speed as well. So it's a weird combination of feeling fast and also like eternity, but it has been a wild time. It's been really fun. And along the way, really my mission has been about making sure that we have clinical voices in the room as we're building these solutions. As I came through sort of the tech ranks, it became really obvious to me that at any given time, I was maybe the only clinician in the room for far too many conversations, and spotting another clinician kind of felt like seeing a unicorn in the wild. And I was like, why is it like this? Why aren't we talking to these people? Why are we just guessing at what they might want instead of asking them directly? And I started it became common for me to get approached by companies saying, oh, you have this clinical background. You also have this product background. That's so unique. We need someone like you. When
Mm.
really all they needed was somebody who could speak both languages, do some translation, or at least just spend time with clinicians one on one, making sure that they're solving real problems instead of problems that we think are the main problems in healthcare.
Amazing. So, how long was it between when you started working in a non clinical role that you first came kind of face to face with another clinician in the room?
I think luckily for me at PillPack, a lot of the operational leaders were other pharmacists, but it was because they were also leading teams of other pharmacists. So I found
Okay.
it quite frequent that they had the right people. I'm gonna change that because I don't want to bash anything about the PillPack clinical structure, but how do I start over? We definitely had clinicians leading clinicians in all of the places that were appropriate. But I found in all of the other business verticals, if you will, in product, in design, that clinical voice was me for a very long time. And then what started happening was a lot of clinicians would come to a lot of other pharmacists would come to me and say, hey, I want to do what you're doing. That looks really fun. How can I
Yeah.
do it too? And so I sort of like informally started working with other pharmacists, coaching them, letting them know that they could carve their own path. No one was asking me to do the things I was doing. I was just finding problems, solving them, and showing my value. And I think that's really like kind of what was the secret sauce along the way. But until then, until those other pharmacists really started understanding that they could bring value too, I was
Yeah.
kind of the only one. So then I took to LinkedIn to find others. And we actually have like a little pharmacists in product group that we formed because it's so rare to find each other.
So, we're talking about finding other clinicians, other like minded clinicians who are doing different things within their role besides delivering clinical care. We have been connected for quite some time on LinkedIn and social media. And then we actually got the chance to meet in person this past fall at Health in Vegas. And I know that you have shared a bit with me about the time in your pharmacy career when you realized that you were ready for a change and what that looked like. And I would love if you can share some of those moments with the listeners.
Sure. I think I talk about sort of this major moment that happened at the pharmacy that sort of led to my decision to move away from at least retail pharmacy as my primary line of work. I got into pharmacy, I think like so many people in healthcare, to help people. I
Yeah.
loved, like I think that's what we all want at its core. And I think over time there were parts of the job that were really taking me away from that. And I could deal with that for a little bit. I could deal with a high volume store. I could deal with it being busy. I could deal with insurance rejections. But the moment that really struck me was the moment that I no longer felt like I had time to spend with patients the way that I wanted to. And people
Yep.
would be walking up to the consultation window just to ask a simple question about an over the counter product. And I'd be like, "Ugh, I really don't have time for that. I'm on the phone, I've got this, I've got that. I really don't have time for this." And that really like struck something inside of me. I knew that it wasn't that I didn't want to help people anymore. It wasn't that. It was that that was no longer really being rewarded at my job. And I wanted to find a place where I felt that that patient connection was going to be the thing, right? Was going to be the thing that I got to do and was going to be valued. So at that point in time, I just said, you know what? I don't see this in community pharmacy. I was at a big box retailer. I don't see that this is going to change anytime soon. I was also about to have my first kid and really wanted to have, to be home for weekends and bedtimes. And I was like, what could that
Yeah.
look like? You know, like what does that even look like in this career path? And that's when I found PillPack, which at the time was small and just getting started, and there weren't really a lot of healthcare startups, but it was local to me. And so I found PillPack, which was a brand new startup at the time and one of the only healthcare startups I had ever heard of. And luckily it
Mm.
was in my area. I went to their website and was like hooked from the start. The mission was exactly what I wanted. It was very mission driven, wanted to help people with chronic illness that were taking multiple medications. And I was just like, if I'm going to leave and leave something stable, this place looks awesome. And I was right. Luckily, it was the most amazing experience of my life.
Yes. Can we fill in some detail gaps that I want to know of how long were you working in clinical pharmacy?
Yeah, it was 4 years as a
Okay.
pharmacist, so post grad.
Yep.
Before that, I had also worked at that same chain for about 4 years too, as a pharmacy technician and intern while I was in school.
Okay. Yeah, you were in it.
Yeah, yeah.
And
And looking
then,
back, it doesn't feel like it was really 4 years, doesn't sound like that long, but it was long enough to
mm,
know that it was, yeah, not where I could spend my entire career for sure.
I actually was thinking about kind of two of these points yesterday. One being that healthcare changes you, whether
Hmm.
you like it to or not. And if you resist that change, it will end very poorly. Like just the way that you see other people, your tolerance for discomfort, the way that you just see human beings walking along. Usually, our bar for empathy goes like through the roof, which can lead to really beautiful relationships and friendships, and can also lead to sometimes you have too much empathy for people who don't mean the best for you. The other kind of thing that I was thinking about, and I've talked to many, many colleagues about this, and we all kind of agree that the 3 to 4 year mark in a career or in any one particular job is that point where it like makes or breaks you. If you're still cruising, you're probably pretty good for maybe the long haul if you want to be there. But
Hmm.
if you start to really question, am I happy here? Does this fulfill what I'm looking for? Does this still align with my values, my needs, and am I getting burnt out in this role? That is kind of like the breaking point timeline where it doesn't feel like a shiny object anymore. It doesn't feel like fun and exciting and new. You're probably on
Definitely.
autopilot. Um, of course, maybe this doesn't pertain as much in like a startup environment where things are just different every day, but your classic clinical job, that is the breaking point when, like you said, when you shrug at a patient coming up to the window to ask a question about a medication. I felt the exact same thing at my role that I just left, which was clinical, and it was my 4-year mark. And it is, yeah, I feel really, really grateful that I listened to that, and really grateful that I had these conversations with others and was like, no, it's not just me. I'm not crazy. I'm not a bad person.
Mhm.
It is time to reevaluate whether this is right for me right now.
Yeah, so important to have that moment of, like, self-reflection to know, "Wait, it's not me. It's maybe the environment. It's, maybe how things are structured here," and to know that there's somewhere else that you can go is really liberating.
Yep. So you went out for maternity leave. I'm trying to kind of piece the pieces together. And did you think to yourself, I can do a non-clinical job? Or, oh, I'm just curious about what other like pharmacy inventions, let's call them, are out there? Like, how did you even stumble upon this company or this idea?
Yeah. Yeah, so actually, your assumption is a good one that I went for maternity leave first, but I actually left my job very pregnant, and I started at PillPack very pregnant. So actually, it was just random. I was considering, to your point, I was like, okay, I have this maternity leave coming up. Maybe I'll consider options then, and I can kind of slow play this. But as fate would have it, I saw a Facebook post from an old preceptor who posted about PillPack because the CEO is actually an alumni of the same pharmacy school as him. So he was just like, oh, look what
Oh,
this alumni did. And it was just a news article and he was like super proud.
yeah.
So I was like, huh, what's this? And I just clicked on it, read the article, and was kind of like hooked from there. Like, wow,
Yeah.
this place looks amazing. And they weren't hiring at the time, but I sent them a cold email and was just like, hey, I'm a pharmacist. I'm really interested in what you're doing. I'm super passionate about the mission. And when you're hiring next, would love to be considered. And that's kind of the rest is
The
history.
rest is history.
I mean, we certainly followed up over a long period of time. So actually, I this was a lot earlier in my pregnancy, and then we talked, and when I finally
Okay.
left, I was quite pregnant. So yeah, I started there as a pharmacist, so I was still working in a clinical capacity, but I was able to just focus on serving patients. I wasn't doing the dispensing. I wasn't doing the billing. I was just focused on patient questions, onboarding new patients, making sure they were getting the care they needed. And it was like a focused role in exactly the type of work that I wanted to be doing. So for a long time, even though I was still working clinically, I was extremely happy there. And it's not because I recognized that I needed to get away from clinical work, right? It's like we just said, I just knew that I needed to be focusing my energy on patients instead of all the other stuff that was surrounding me in retail
Yeah,
pharmacy.
absolutely. It's such a beautiful thing to redistribute your strengths into areas that fill you up. Like, it's so empowering to come back to the things that are beautiful and wonderful about medicine, like
Hmm.
education, like helping people to understand, like even building systems to, make the whole process go smoothly. I think that that is sometimes we get caught up in the weeds in the medical world about like, oh, well, if I'm not managing someone's map, I'm not a real whatever. And
Right.
we're like, if I'm not, double checking and calculating this person's dose of amoxicillin suspension, am I really a real pharmacist? And there are such wonderful other ways to use our education, to use our experience, and to use our skills as clinicians to really help patients that I think are super undervalued. I've been thinking about these things a lot recently with my recent job change.
Mhm.
So this all feels very topically accurate and yeah,
Yeah.
relevant.
I love how you put it. The redistribution is that's a perfect way of putting it.
Yeah.
It's lovely.
Yeah. Yeah. So, okay, so you're at PillPack now. You're working clinically. What
Mhm.
changes to help you transition to take on more non-clinical responsibilities?
Yeah, I think this is a really important point because so many clinicians I talk to, I think, have reached the breaking point and are trying to run away from something, but don't actually know what they're running toward. I was lucky enough that I was very happy in my clinical role there, but I was seeing other things that were interesting to me and I was pursuing them rather than just trying to get out of something. So it
Mhm.
happened very naturally. I wasn't like, "Oh, I'm gonna work non-clinically now." Like, that was not even something I had even thought of. But what that really looked like was I had grown to be managing that customer experience department. I had technicians and other pharmacists working for me, but there were also a lot of things that we needed to be doing that needed management that weren't people management. It was project management. We needed someone to come up with standards for how we did this and that. We needed someone to come up with, how we chatted with our patients and what our SLAs were and how quickly we got back to people. Like all of the little small edges around how we wanted that patient experience to feel were all things that I kind of thought we could standardize in some way and ultimately could serve our patients better. So they started as ways to just help my team until I
Mhm.
realized that I was spending a lot of time focused on these other non clinical pieces that were extremely important to the patient experience, but were not necessarily rooted in answering clinical questions. And it was at that point in time that I routinely went to my manager and was saying, "Hey, here are the things that I noticed and worked on this week. Just wanted to give you a heads up." I was kind of consistently showing the value. So when the conversation came where I had to say, you know what, I'm really enjoying this and it is taking up a significant portion of my time. Do you think
Mhm.
I should just transition to doing this work and maybe you can backfill me with someone else to do the clinical part? It felt very natural because I had been sort of building up to that anyway. And that luckily they said yes. And that's sort of where it started. And I became a project manager from there.
Incredible. So, right place, right time, right skills, right opportunity to lean in to these non clinical skills and tasks that felt aligned and fulfilling for you.
Yeah, absolutely. And to your earlier point, right? I felt like I was just redistributing my time to make sure
Yes.
that I was solving the root causes of things that I was seeing. When you're answering the phone all day talking to patients, you're hearing what problems they're having. And you're like, well, I want to go solve that. I don't want to just hear people calling in with that same problem day after day. I think that's just natural. And so that's what I did. I would write them down. I would start tackling those root causes, hoping that our call volume would go down. And yeah, my skills just sort of naturally fit in.
Amazing.
Not from an efficiency standpoint, right? I loved talking to my patients, but calling us was just one more thing they had to fit in their day. So
Totally.
if they could get through their day not having to call their pharmacy with a question, that's a win. So that was really the goal and providing great
Yeah.
service and care.
That's a win win situation.
For sure.
Point blank. Win win situation for sure. Yeah. Yeah. If you can, I mean, if you can inform, your customer to the highest degree and then they don't have extra questions for you, you know that you've built a really good product.
Agree. Yeah, absolutely.
Yeah. Great. So, thank you so much for kind of going over your experience with PillPack and how that natural transition happened. I find it interesting always to hear the stories about that first position. Like sometimes it's truly a black and white, I got connected to this company and I started just hitting the ground running on this non clinical thing. Sometimes it's more of a slow, natural transition. And sometimes it's somewhere in between.
Hmm.
But yours sounds Truly really natural. I always really like to share those stories because I think it's a great example for other clinicians to learn that there is not just one way to get there. There are so many different ways to navigate that path and like dip your toe in without fully committing with
Yeah.
those opportunities. Yeah.
Yeah. Absolutely.
What did your next period with PillPack look like? And what was the next kind of transition in your career for you that led you
Mhm.
eventually to becoming a product manager?
In my role as a project manager, which really like wasn't a role that existed before I took it on. They didn't have other project managers. I was just like,
Sure.
"Here, this is what I'm going to be doing. Call it whatever you'd like." um I was working very closely with the tech and product teams, really trying to be the mouthpiece of the clinical operation, saying, here are the tools we need to be able to serve our patients. I'm spotting this. I can maybe take this project 80-90% of the way there without technical involvement. But then, really, what it comes down to is that we also need some changes to our tools. And so I was regularly in conversations with these teams to the point where I think people started saying like, "Hey, you should really consider product. You're kind of already doing the job." And for me, I was like, I don't know. I have to be way more technical to do that job. I'm not technical
Mm,
at all. That's not for me." Certainly, honestly, I didn't even know what product management was when I first started PillPack. So it felt very silly to me to be considering some job that I didn't even know the title existed 2 years before.
yeah, yeah.
But, it really took a lot of other people spotting that I already had the skills for me to recognize them myself. What really pushed me into it, though, was in 2018, Amazon acquired PillPack, and as a part of building out Amazon Pharmacy, it felt very natural for me, someone who understood how PillPack was delivering care and how the full operation worked to be a part of the product team in building the Amazon pharmacy product to sort of
Yep,
connect the pieces between how we were going to, merge the businesses and
yep.
deliver on this new solution as well. So I could sort of take all the learnings from PillPack and apply them to what the Amazon product should look like. So I was a part of that launch team in 2020 as a part of the product team.
Another true startup.
Yeah. Yes, taking
Amazon
something from 0 to
2018.
1.
Yeah, most definitely. Pre-pandemic Amazon. I have a friend who also worked for pre-pandemic Amazon, and she had I mean, it sounded like it was probably a very good company to work for, um, in those days, but so many moving pieces all the time and moving at such a high, high, high pace.
Yes. I tell people, there was probably no better place for me to learn product management as a discipline, as a craft. It's interesting because I think people look at technical roles as just that, like a skill set, very technical. But aside from clinicians, product managers are some of the most dedicated to their craft that I've seen, as far as like
Mm,
constantly learning about it, constantly reading about it, constantly learning new frameworks and new tools to make them better at what they do. It's not just like I'm a product manager and like that's it. It's a constant learning from others on how not only how to make products better, but also like how to do product management better.
okay.
It's a very interesting role to be a part of.
Yeah. How would you differentiate for the listeners who might be confused the difference between project and product management?
It's a great question because I've had all the PE roles. I've been a project, program, and product manager. So yeah, I'll kind of move in that order. Project management is definitely a bit more task based, executing potentially on somebody else's vision, but doing it very well, really being more of that execution arm. And then program management was a little more higher level from that, which was really around, owning the metric for a specific part of the business and maybe owning the strategy around it too. Perhaps you manage a couple of project managers that are actually doing the execution piece, but you have that sort of strategy level ownership of something that the operation is responsible for. And then product management is, well, my experience and the reason that I made the decision to join the product team was because as a program manager, I felt slightly bound to someone else's decisions around what to prioritize. So,
Mm,
similar to what I mentioned, right? It's like I could get maybe something 80 to 90% of the way there, but then I was going to need engineering support to actually get us the full 100. And so then you kind of have to like petition to get something on the roadmap, you know, tell people why it's important and then hope that it gets prioritized against other things. And ultimately, I wanted to be the person who was prioritizing those decisions for the business. And that's sort of what drew me to product was making those types of decisions. So you really are working with engineers, working with designers, and prioritizing the full roadmap around
mhm.
things that need to be developed. So I think like functionally, you're still owning a strategy. You're still potentially the visionary when it comes to product versus program management. It really has more to do with your interactions with the software development and the product development lifecycle and sort of where you fit in on how decisions get made around prioritization.
Okay.
I could say more on product if we want to, but I could also stop there. It's a nuance.
I'm curious why you feel clinicians could make particularly great product managers.
That's a great question. I think one of the hallmarks of a good product manager is that this is not like something I made up. This is a very famous quote that people say, right? But like they fall in love with the problem, not the solution. They are they become obsessed with understanding their users' problems and wanting to solve them and being very creative about potential solutions and then weighing why one solution might work better over another. And I think clinicians have that exact same skill set. We don't go into solving patient cases always with one solution in mind. We know
Mhm.
that patients are complex and different solutions may work for different people. And there are a lot of nuances to why, right? I think that clinicians are very good at asking open ended questions, getting to the root of a problem, and being very creative about how they approach problem solution or problem. How am I trying to say this?
Solid.
There we go. Problem solutioning. Yeah, they're very tactical and skilled in how they go about problem solving. And I think product managers need that exact same skill set. I think while some of the conversations are happening with different people, right, and they may sound more technical in nature,
Sure.
it really is one and the same. It's problem solving. It's just a different you have different tools in the toolbox that can be used instead of
Mhm.
medication versus surgery versus, you're looking at then two different software solutions or an operational solution versus a software solution. So I think the skill set is super translatable.
Fantastic explanation. Thank you. I think that that gives a lot of great insight into why clinicians might explore a product manager role, and what they have to bring to the table and what their transferable skills are. Can you talk about if someone is interested in the product role? What are some of the terms or words that might feel unfamiliar right now that they could go and research and learn more about?
I love this question. First one is roadmap. I feel like roadmap gets tossed around a lot. Is it on the roadmap? I'll put it on the roadmap. That is really just the plan. It's really just what is the plan? Also, another one is backlog. And that's something that, might get on the plan eventually, but isn't something that we're focused on right now. I think both of those are extremely translatable to things that we think about in clinical work. You may have a treatment plan that you're currently working with. You may have other things in the backlog that you want to work with a patient on, but they're not the highest priority items right now. We know that people can't tackle, you know, 15 different health concerns that they have at one time. So prioritizing what to tackle now versus later is really all that roadmap versus backlog is. And then we have KPIs is a big one, key performance indicators. So really that's just How are you going to measure success? That is really just around metrics. Again, super transferable. You think about this all the time in clinical work about what indicators are actually going to show improvement in a patient's condition. That's all that is. And it really is like setting those things up front and then understanding how to track progress as you move forward with the project. I think those are some big ones. Um, every day, honestly, when I talk to engineers, I'm hearing new terms.
Mm.
There's always like something. And I just ask if I don't know what it means, because guess what? They also don't know what some of the clinical terms mean. I've had to explain HIPAA, I've had to explain prior authorizations,
Yeah.
but they've also had to explain to me what a JSON blob is. That's a real thing that I've heard, more an S3 bucket. So it's kind of, I don't want anyone to get overwhelmed with the amount of new terminology they will hear because it is constant. But if you prioritize finding an environment where people are supportive and
Mhm.
you can ask questions and you feel comfortable, then you'll learn and it's all good. It's
Mhm.
been a great learning experience.
Coming from the medical, not pharmaceutical world, I always think about like how many crazy medical terms there are. Like you didn't know what are some funny ones? I don't know. I always thought that like polymyalgia rheumatica as an official diagnosis just sounds insane. The term like bezoar, the term like I hear some of my friends. I had a conversation with someone the other day, and they were like, "I have this crazy thing on my face. I've been Googling it. I think it's a papule." I'm like, "Oh my gosh, let's break it down." So yeah, there are so many there is so much unfamiliar terminology in any new world that you enter into, sometimes in an unprofessional setting, sometimes in a professional setting. And if you are able to be open to not knowing everything and not afraid to ask questions, not afraid to feel like the dumbest person in the room, even though you probably are not, far from it. Um, yeah, it can be such a great learning experience. So thanks
Yeah.
for going over some of those.
Yeah, absolutely.
You have a business, a newsletter, a blog called Hey Health Tech that my understanding is that it was sort of born out of the conversation that we're having right now of people kind of asking these questions, asking for more information, asking for you to share your story with them. And you realize that you could just share it on a greater platform. Can you talk kind of about the formation of Hey Health Tech?
Yeah. Yeah, so the name Hey Health Tech really comes from like just trying to make this information feel accessible and approachable to people. It's like, hey,
Yeah.
right. Um, I I think health tech can feel a little scary slash amorphous to people, becoming a huge industry. And the bigger it gets, the people that are actually working clinically and delivering the care somehow still feel even further away from it than ever before.
Mhm.
So you're right. I was having these one off conversations. People had been approaching me at PillPack in person. And then as I started posting a bit on LinkedIn, people were reaching out to me there asking me about my journey. And yeah, I was kind of like, wow, instead of repeating myself, I could just kind of share on a broader scale. So that's where the newsletter was born. Also created a job board because I found that people were asking me about, well, what types of roles are there? And to me, now having worked in the space for so long, the titles seem really natural, but for everybody else, they can feel sort of like a foreign language. And certainly you see a title that you've never associated yourself with, and you're like, well, that's not for me. That's not something I can do. I've never heard of that, sort of how I felt about product management. And so the concept behind the job board was not only can you see that there's lots of opportunity out there, I feel like there's concern that maybe it's too saturated or maybe the opportunities are drying up. Nothing could be further from the truth. Not only are there a lot of opportunities out there, but here are some examples of ones that are currently open and what the titles are. And they're not, fully representative of everything that clinicians might qualify for, but in my experience, they're the ones that make the most sense without, too big a leap into a different skill set. So
Mhm.
I'll post things that are in operations or marketing or product or compliance. Usually no software engineering because it's a completely different skill set. But yeah, I found that it has been really helpful in sort of getting people familiar with what's out there.
I'm headed to the job board right now to call out some of the roles that are on there.
Love that.
So, partner success with Savant,
Mhm.
clinical success director of nursing, implementation manager, director of implementation, all with a bridge, head of clinician science with a bridge, operations manager of the care navigator team with Lyra, staff product manager, account manager. And the one of the cool things about Lauren's job board, in my opinion, is that you start to get familiar with the companies. You start to see the same companies over and over and over. And I think that that is such a great way to do some discovery and self reflection on what are the missions that I feel like I want to work on? What are the companies that are doing the things and building the products and the solutions that I want to be a part of building? I love that you have things ranging from cancer care to ambient listening software to MIDI is like, I think menopausal care.
Exactly.
Yeah. So it ranges from all different headspaces on here too. So more psychiatric and behavioral health. That's one of my favorite things about your job board. And I think that maybe there's one or two others, made by human beings in our space who just do a really great job of curating them. And it allows you to do a really slow, thorough exploration of the roles that are out there, the companies that are working on what you might want to work on, just to kind of get yourself more familiar with the business.
Yeah. Thanks. Yeah, that's the hope. I'm a pharmacist, right? You're a PA. It doesn't matter the background. Our clinical skills, the ones that are the most transferable, are really quite universal, regardless of specialty.
Yeah.
I do want people to see themselves in the role. So, if you are working in cancer care now, it does make sense to probably apply your skill set in a cancer care.
Start there. Yeah.
Exactly. But I don't want anyone to feel boxed in. So, yes, certainly all clinicians of all backgrounds are sort of who I'm targeting with these jobs. So I'm glad you find that there's a good variety there.
Yeah. I've certainly used it to apply to do the wrong strategy and just shoot blanks everywhere. And be like, hey, if I throw something at the wall and it sticks, then great, let's check it out. I, have since learned that that was definitely the wrong strategy to go about it. But, lesson learned, all is well. Nothing lost except for many hours of my time.
Fair enough.
Can you talk to me more? A huge change in our industry is happening. Everyone is talking about it. AI is here and I think is here to stay. I'm curious if you can talk on how it has changed your professional life in terms of your, full-time job, but also within how you operate Hey Health Tech.
I think I have a couple of takeaways from my full-time job. And I think that it's an interesting time for me because it's the first time in my career that I have felt like there's a real, like, we can feel it happening in real time that technology is about to change healthcare. I think for those of us that have been in this space, we've seen it coming for a long time, but it's hard
Hmm.
to sometimes it's hard to really recognize when the transformation is going to happen, when, like, I can still walk into a CVS and see a fax machine, right? Like, it's still there. People are still using them. That is the technology that the healthcare system is is really, like, riding
Built
on still.
on.
Yes.
Yeah.
That is the foundation.
Pioneers used to ride these babies for miles.
So I think that, like, knowing that I'm working in the space, but then seeing that felt like such a, like, incongruence for me all the time. And I think that this is the first moment in time where I'm like, wow, when I talk to clinicians now, they're getting it in a way that I haven't seen happen before and is so exciting.
Mm, mhm.
People are using these technologies and seeing all that they can do in a different way. So it has made my job, my 9 to 5, feel a lot more, I don't know, not like a lot less aspirational and more. like, oh, these are real things that people are really using and they're changing lives already. We're not like building towards some future that doesn't yet exist. I think is one interesting change that has happened for me. I think that the other is really just like grappling with the fact that we've been sort of waiting for this moment to come for so long
Mhm.
for technology to really transform healthcare. And I still don't think we prepared ourselves for the amount of fear and lack of control that can bring, and how much change management is necessary in really executing and implementing on these things. Just because the technology is available doesn't make it magically get used. So I think we have like a lot of work still to do there. And I think that that's probably where, I'll be focusing my time as a product manager. And I think a lot of companies are really spending their time is hiring implementation managers to help with that gap, hiring management professionals to also help. I think that that's new in technology. Whereas before people were like, you build it so intuitively and people will just use it. It doesn't work like
Yeah.
that in healthcare. I think in Hey Health Tech, I have been focused a lot on trying to teach what's happening and focus on
Mhm.
like, here's the news. When I want to shift things into, here's how I'm using it to build the business, right? And here's how you could use it in your day to day life as well as starting to, um, I don't know, harvest more conversations between clinicians about what they're doing in their day to day, what they're learning, how they're learning it,
Yep.
and how they're applying skills. So that's sort of the shift that I'm looking to make in the business with it. I'm just like everybody else, right? I'm still trying to figure out how do I best use cloud to make my life easier. how do I how do I get it to find jobs for me so I don't have to manually
Yeah.
click publish on all these jobs? I think there are a million problems that could be solved. And I think the thing that people are talking about right now is how do you figure out how to prioritize what gets done in a world where
Yeah.
anything is possible? What do you do first? And that's the question I'm answering every day, both in my 9 to 5 and in Hey Health Tech.
It's a big, heady question, right? Yeah. When so many things are possible, when I could build an app to find me like the cheapest round trip Google flights and also to prep all of my podcast episodes for me and also to, I don't know, um, trace my genealogy tree and all of them will take 2, 3 hours and I can do all of them at the same time. What do I do first? Because it's all so fun and exciting. Yeah.
Exactly. It's tough. It's tough, and to some extent, there's no right answer, but yeah, it's a tough problem to be solved.
In your full-time role, are you implementing any tools in your day-to-day?
Yeah, so, I think like any company, my company is certainly focused on AI transformation right now and figuring out how we
Yeah.
can best use tools to help speed our processes, to help our documentation. I think that's actually one of the most under understood things about working in tech is like everything that gets done has to be documented in some way. People have to be able to reference how does the thing work? How was it supposed to work? How is it actually working? What's the gap? So documentation in tech companies is often a really big focus. And so I think that's the one place that we've doubled down so far is not only using it to help us document, but then also using it to help us search those documents for answers to our questions. Sometimes it really is just like, oh, I'm seeing this weird thing. Is this how it's supposed to work? And tracking down the right person who knows the answer to that. When
Mm,
now it's a lot easier to use AI to help you out with that. I also think just in general in product, what we're seeing is that product managers and others adjacent to the product development lifecycle are really being asked to prototype ideas before bringing them and having them really fleshed out by an engineering team. So you can kind of
interesting.
have
Yeah.
people react to like something real as opposed to an idea that's just in your brain. I think that's a new skill set that every product manager is looking to build, but also I think it's really helpful for anyone to be able to do that. It's not just about writing good documents or creating a good slideshow anymore. It's really about like how can you prototype something that people can respond to so that they don't have to guess what you're thinking and connect the dots. They can just see it.
Real time. Yeah. Are there any, just out of my own personal curiosity, what Have you been using mainly Claude for that function or any other kind of app building platforms?
Mainly Claude. I have yet to try Lovable, but that's on my list of things to try as well.
Yeah. I have not tried Lovable. I've seen a demo of it that looked fantastic. My arsenal has been Replit this whole time. I've taught a
Mhm.
couple things on Replit, and I like the UI, I like the product that it makes, and nothing that I'm making is for, serious business, so it works for me. But
Yeah.
I would really like to try some others, so I'm always curious to hear what other people are enjoying.
Yeah, for sure. Me too. I feel like I'm collecting a backlog, right, of all the ones that I wanna that I wanna try.
Bring it back. Love it. All right. Well, we are wrapping up and winding down on our time. If the so the audience that I am most trying to reach within my podcast are people who are thinking about what could be out there for them and people who are already on that hunt. Maybe they have already started their first job in health tech. Maybe they're already 2 feet deep in the world of health tech, but all of these folks will have a clinical background. So this isn't, our first natural path. I'm curious if you have any advice for any of the listeners if they are maybe looking to make a jump in the next 6 to 9 months. What would be some solid steps that they can do in the next, like, 2 to 3 weeks to get that ball rolling for them?
I think my first piece of advice would be to have them sign up for the Hey Health Tech newsletter because this is exactly why I write it.
Yes.
I cover not only things that are happening in the industry that you should know about, and I also cover how they might impact your career. I also highlight a few job openings from the job board every week that might be interesting. My second piece of advice, because that's great, but that's just information consumption. And part of this transition is really also putting yourself out there. So my second piece of advice if would be if you're not already on LinkedIn and actively networking with folks to do that. And it doesn't have to be LinkedIn, right? It could be in person as well. But if you're saying in the next 2 to 3 weeks, right? I don't want anybody to be able to say, "Well, there's no events happening in my area in the next 2 to 3 weeks." No, there's
Sure.
something always happening on LinkedIn. So get on there, connect with others that are either trying to do the same thing you're doing, have already made the transition that you're making, or just that you find interesting and are saying interesting things about things that you care about. I think those are the two best places to start. So sort of curating your information diet and then also making sure that you're not just consuming, you're also interacting with others is really important.
Now, next level question for someone who has been in it for a number of months or years, what do you find are the highest value actions outside of, their work that they can do to stay updated on things in the health tech world? Things move so quickly.
Yeah. Well, to be honest, still the newsletter, right? Because one of the reasons that
Yeah.
I write it is because I want to keep up with this stuff too, and I'm trying to write about it as fast as it's happening. So definitely still the newsletter. I also have a community that is for this exact purpose as well, which is regardless of where you are on this spectrum, how can you keep up to date with what's going on and what people are really working on in health tech? So that's a good place as well. And then I think the next piece is back to the in-person thing, right? I think you and I have
Hmm.
both found that going to conferences can be a place where you can just really immerse yourself and see a lot of the technology firsthand to the people that are building it. I think in-person conferences are going to be the winner in 2026 and beyond. And I get that they're expensive, but it is worth trying to pick one or two and really getting yourself in the room.
You don't even need to buy a ticket, it turns out. You
That's
just have
true.
to
You
show up.
proved it. You proved it.
I did prove it this year.
It
Yes.
was impressive work.
Thank you. I try my best. All right, Lauren. Well, thank you so much for sharing your time with me and with the listeners. I will link your LinkedIn as well as your website, which for the listeners, if you want to go straight to it, it's heyhealthtech.com. Lauren has some excellent resources on there. an introductory guide from frontline to online, which is a PDF file. The job board is available, and then a really quick link to the community is available as well. Very easy to navigate.
Well, thanks for having me. And I think to the listeners, clearly you're here because you've given a transition like this at least a thought, at least a passing a passing thought. It really is possible. If I can do it, anybody can do it. I am not special. I just followed my interests and I really want people to do the same. I think a lot of clinicians haven't thought about what they really want out of their careers in a
Hmm.
very long time. And
Hmm.
if that's you, now is the time to be thinking about what you actually want and believe that it's actually possible because it is.
A great way to wrap things up. Thanks again for the reminder. Listeners, please rate us 5 stars, share us with a friend, share us with your mom. I don't know. Give us some good feedback. It does help the show. I am bringing this to you because I'm having the time of my life learning from incredible clinicians and always constantly feeling inspired and feeling motivated to expand my horizons. If you are a clinician who feels like you should be sitting here in the room with Lauren and I having this discussion, feel free to reach out. I'd love to talk to you and share your story as well. And thanks for joining us for another episode of Corporate Espionage. We will see you next time.